Hello, you're calling Politics Done Right live on air. How can I help you?
I am 76 years old. When I got my Medicare at 65, I didn't know the difference between Medigap and the Medicare Advantage. So I ended up getting a Medicare Advantage in Minnesota. Now I'm in Michigan. I got a Medicare Advantage here. And when I had my wrist broken a couple years ago, I would have had to pay a few $1,000s because I needed surgery on it. And luckily, the hospital, because I'm poor enough, I was able to get the extra money paid by the hospital. So this last fall, I contacted a representative in Michigan to find out how I could get Medigap. And I'm very healthy. I ended up calling Allstate Insurance, and I was able to get Medigap, and I decided to get Plan N, which is covers everything except your copays. And I just want to say I was so disappointed with Medicare Advantage. It was almost like having no insurance at all. But I want to tell people that you should work on getting your Medigap because it's possible. Also, when I went in for my wrist, since I had the hospital helping me, I checked out a problem on my forehead. It turned out to be cancerous. So I had surgery done on that. And I was still under, that Medicare Advantage, and they wouldn't cover part of it, but I had the help of the hospital. So I was so happy the day that I could cancel, that all my Medicare Advantage was canceled, and that I wouldn't have to worry, because I'm 76, about future problems. Yay!
Let me tell you, Barbara, your testimony, something that happened to you, is more important than anything I could have possibly say. I want to thank you so kindly for you calling into the program and telling us your story. And this story is going to be played in other places because it is important for somebody who lived through what you lived through. I want to reiterate one thing about your discussion here, and a very important part of your discussion. You were able to jump back from Medicare Advantage to traditional Medicare, and you could afford the Medigap because you were still healthy and didn't have to go through the what they call not amortization. That you didn't have to go through the actuarial tables again. So for anybody who's listening right now, they should follow your lead. And that is, as if you're still healthy, go ahead and switch back to your traditional Medicare. Anything else you'd like to say, Barbara, before you go?
I was just surprised to get on the air. That's why I was so stumbled at first. But
let me just tell you, I want to again.
I encourage people not to fall for the Medicare Advantage. I also had a dental plan through that, and they dentists up here, I'm in the Upper Peninsula, Michigan, there's only a few dentists, so I was really limited. And none of them would take it, the Michigan Medicare Advantage. So I have a new dental plan, too, that I can go anywhere in the United States that takes it. So yay, I'm happy.
Now, Barbara, Barbara, I just love that you called here and told us your story. Thank you so kindly. And please keep listening. Let people know about the program so that we can make many people aware of this reality. Because, like I said, your testimony is much better than anything I could have possibly said. Thank you so kindly for calling.
You're welcome, and thank you. Bye.
Have a great day. Folks, that story made my day. First of all, I'm happy, first of all, for Barbara. Okay. That it worked out for her was exceptional. Exceptional. If you are on Medicare Advantage and you are healthy, see what it will take to go back to traditional Medicare before it's too late. In effect, that is what Barbara just said. Let's remember that.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number one, subscribe to our channel, and number two, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.